Hello, everyone. This is Ed Brendiger, and welcome to the Eddy Network podcast. I'm delighted today to have my guest, Tina Marsh Dalton, who is an economist at Wake Forest University. And we just met a couple of weeks ago,
Hmm.
and we were just passing in the fellowship hall of the church. And I guess you were waiting on your kids, and I was headed to choir, and we talked for about 2 minutes, and then boom, here we are talking here on the podcast. And I'm so pleased to have you here. And Tina, tell us a little bit about who you are and the things that kind of capture your life at this point.
Well, thanks for having me. Uh, yeah, so I'm in with Salem too, and what I do with most of my free brain space is I talk about health economics. So I study the economics of the healthcare system. That's what I'm really excited about because I feel like there's plenty to talk about and there's plenty to fix. I'm also a mom. I've got kids in elementary school that are currently not in school because of all the snow. I don't know when they're going back to school. And I'm married to another economist. So the other big thing in our life is just economics everywhere, just trying to figure out how the world works. I've been interested in it. I was just talking to somebody since I was 17, because that's the 17-year-old I was, I guess. But I like how it shows up in all kinds of places. And I teach about it, and my kids, I have videos of like my toddlers doing things, and we're like explaining an economic concept to them.
I love that. I think that's really exciting. And so what's it like for a college, say a college freshman to come to college and take their first economics course? What's that like? What are you
Mm.
what are you covering in a course where they're beginning to be given some kind of grasp of economic theory and practice?
Well, that's interesting to think because you were saying that you're interested in this like college age group and what are they like? So I just started teaching, well, not just, but for a long time I would only teach sort of upper level undergraduates, and they've got it down and they know what they're doing. And especially at that point, it was really hard to get into my classes because we didn't have enough faculty. They already believe the stuff, right? Like because they were in the major and you can only get in my class if you've been doing it for a while. So then I started teaching freshmen, and it was like kind of a shock to my system because they're just barely out of high school. They're kind of squirrely. I would try to connect with them by being cool or something, like what is it that you study? I kind of hate the textbooks. They're always like, well, you could have beer or you could have pizza, right? It's like because that's all you think about as an 18-year-old. The students are not like that. I asked them because I have to give examples in class, and I was like, well, why don't I give examples of like stuff they're interested in, right? Like basketball tickets, like what do you guys spend? What do you buy? And they were like, water. I was like, that's really what you buy. I think no one like wanted to share, like, oh, I buy designer shoes or something. But then, like a few last year or something, I was like, what is a problem that you're really worried about in the world? And then I got so many answers back. They were really worried about housing. They're worried about poverty. They're worried about food insecurity. They're worried about climate change, right? And I was like, oh, okay. Like, let me work through the economics of those and all the ways that economics can help. And sometimes they'd be interested in healthcare, and then they'd be my special friend. But they were all very interested, and it's very exciting. Because I think economics has something to say about all these problems, and not just politics, right? Economics is just trying to get to the truth. So economics is like you might like the minimum wage sounds good, but then if the minimum wage goes up and it makes people lose their jobs, like that's the actual truth, right? And so
Yeah.
we're trying to I want to teach students economics so that they can look at the world around them and know what is just sounds good and what would really happen. So that has been really fun. Once I started asking them, what do you care about? And they care about a lot of things. They want to fix the world. So trying to teach them some economics that they could bring to their problem. Because we talk about there's two different areas in that economics touches, like maybe in biology or something, you just have the science. Economics has the science and then the policy, and the policy is interacting with what our norms are. So do we want to help babies? Do we want to help old people? Do we want to, like during COVID, we were facing this. Old people were most at risk. Should we shut down the schools? But then that's to the detriment of the younger people. We had to make decisions, and this is a norm, right? So economics as science is like, I don't know what you want to do with that. You got to make a decision. But what I feel like economics as science does is like if you figured out your norm, we are on board to try to help you really achieve the most you could for what you decided was important.
I'd love to see it in on one of your classes. I mean, I mean, for a whole semester, because that kind of dynamic level of questioning is really important for people. And I don't think that they ask that, once they get to a certain age, they stop asking those questions um, on a more theoretical I'm saying macro, but it's not really a macro level.
Yeah.
It's a micro level because it's
Uh-huh.
personal, but they're more being more theoretical about their life, but otherwise they're just figuring out how am I going to pay my bills this month.
Yeah, yeah. And in healthcare, I think this is important too. I think it also is in terms of trying to solve any problem in the policy realm. It's you really have to understand what are people's goals. Um, if they're not trying to achieve the same goals, then you are gonna. But it might be that people are trying to achieve the same goals, right? Like if you are pro minimum wage or not, right? The idea is you have these poor people you want to help. So I actually have something I call it's the Tina Marsh Dalton policy analysis like framework. It is don't have the policy do the opposite of what you were trying to achieve. Like that's the minimum bar I'm trying to put on policies. They don't all achieve this.
Yeah, I agree
But
with
it's
that.
like if you're trying to help a disadvantaged community, you want them to find housing. If you put in rent control, it's going to destroy the quality of their housing. I just like so we just want the economics out there to be like, is that what your goal was? If it wasn't, maybe we should pick a different policy. Like we can still focus on helping them, but pick a policy where, you're giving them job training so they could afford the houses or something like that. That's where I think the having the conversation about what is it we're trying to achieve, because sometimes the economists I think are put up there as they're like how are you going to pay for that people right right like when we were going to expand Medicaid and people wanted to expand Medicaid because they're like well people don't have insurance give it to them and then the economists are like yeah but how are you going to pay for that right but if you don't have the money for it you can and one problem with Medicaid is often it's expanded but because the reimbursement rates are really low doctors won't take the
I
insurance
know.
so it's like here you go we gave it to you and it's like you didn't do anything with that because the doctors don't take it so thinking about what's the real goal and using the economics to try to get at the goal we're all trying to get at together.
So it's sort of this area of life where everything else kind of feeds into it in some way. So, for example, I mean, a lot of what you've just described is asking the question, what can government do and what can it do? And why do we not think that it can do everything? Why do we think it can do everything when it really can't?
Mm-hmm.
And how do we pay for it if how do I'm thinking about New York City, and how are they going to pay for everyone to have free transportation throughout the city?
Ah,
And so it's like the politics of this is as significant as the actual policy, and so how do you address that with students? How do you get them to think very clearly about these principles? Because I mean, what I have seen in the past is that um, they get they get trapped into becoming ideological about one thing or another, and particularly politically,
mm-hmm.
and therefore that becomes the thing that defines what their economics is,
Yeah.
and whether it's very liberal, leftist, or very conservative, or whatever it may be, they say, okay, this is where I'm starting from it, but it's not really a rational sort of thing. We're not really looking at this thing rationally. We're having to deal with our own human propensity to take sides in things, and that becomes really problematic if we don't have really good leaders. This comes back to my thing. Have really good leaders who are able to see the bigger picture and say, calm down. Let's actually talk about this and see what we can do and what we can't do.
Yeah, that's a good point because all these things take time and learning about them is hard. And so it is a shortcut to just say, I'm going to take the policies of the right or the policies of the left, and they're telling me what a policy is. So I'm just going to, that's now what I believe. Yeah, I guess what I try to work through, especially I teach the intro course. So especially with the students in the intro course, just try to work through all the implications of the problem. So what I do in my health course, actually, so in my health course, there's only three things you need to learn the whole semester. It's great. Like we finish them like up in week 7, so it's they have the rest of the semester to coast. But the first thing that I do, I call it correlation versus causation, but it's the idea of when we're thinking about things that improve your health. So one is medical care, maybe. Um, Others are the environment you're in, or your lifestyle, or your genetics, or things like this. And then, so if anyone's listening from my class, they'll get the first midterm question now. I put it on every midterm, and it's often wrong. Um, I just say, discuss the connections between income and health, or education and health, and tell me why one might cause, like why income would cause health. Okay, they write it, whatever. It's fine. There's lots of stories why income might cause health. You can buy better food, you can get better health insurance. It's probably means you have a better job, so it's not as taxing on your health. Okay, whatever, right? Whatever you want. I don't even read it. And then the second part says, discuss or explain why income and health might be correlated, but not causal. And that like blows their mind. The idea that I have to, what they don't understand is to show that something isn't causing something, you have to identify another cause that is actually driving it. So you have to say something like, well, it has to do with motivation. If you have a high level of motivation or like a lot of self-discipline, you're likely to get a good income because you work hard and you're likely to be healthy because you exercise every day, right? Or it could be education. It could be, I have a good education, and so that means I make good health choices, and it also means that I got a good job, right? So in that case, education was causing both of the outcomes to improve. Um, and they get all the points off, right? Like I actually often have like a surprise extra credit that happens because they get it all wrong. It's very effective to have everyone fail this question because then they pay attention. And the idea is people are going to tell you stories, but you need to know what is the real story happening in that setting, right? All of those stories I told are true, right? All of those happen. But then I say, like, I really care about this. Why do I really care about this? It's because what we call the marginal dollar, right? Like we have, $10,000 we can devote to improving health. Or maybe more than that. The budget's really big, but still it's limited. And you need to know where it needs to go. So if I thought income causes health and I just hand out money to people, if it was the story of I can use it to buy food, then yeah, we improved health. But if it was the story of I needed to get an education, that didn't do anything. We should have put the money into the public school system or something like that. And so I'm like, all right, you're spending it in the wrong place, whatever. Students are like, okay, that seems bad. And then I'm like, no. If this is COVID and I'm trying to figure out what's going to cause health, I could spend it on vaccines or I could spend it on better ICU equipment, right? Both of those are going to improve outcomes. I have to pick though, because I only have so much money. And if I put it in the wrong place, I'm literally killing people. So, like in the case of health, I like to be pretty draconian about it, right? It's like if you put it in the wrong place, people died because you put it in the wrong place. You wasted it. And so it's not a joke. It's not like, oops. No, it's like you got to think about this. You got to think about what is the true mechanism underneath and is this the best place to put it? So I try to get to that final, it's not harmless to be wrong. Like, because that money could have saved lives and it didn't.
Is this where, and before I say anything more, you have to understand that the only course I have ever flunked in my life was the intro econ course. And I flunked it
It's
because
a
I
good one
did,
to flunk.
huh?
It's a good one to flunk. You're in good company, I think.
Well, I didn't understand the multiplier.
Oh, yeah, it's macro. We can set that aside.
Yeah, but that's so but that motivates me to try to understand this better as a result. So that, obviously. But what I see here is that the philosophical underlayment of economics is really important because you're making philosophical choices about people and society and communities in your choices of where you're going to apply whatever bag of money you have to apply to things like healthcare or to schools or whatever. And you have to have a kind of a philosophical, or you have to have a set of values or a set of principles upon which you're making these choices.
Mm.
And is where are we in the larger field of economics where we can talk about those kinds of those more philosophical questions? Is that happening a lot in your world?
There is at Wake Forest, there actually is a bioethics minor, and there's some folks, there's a bioethics center. So I feel like they work on these questions a little bit more. I tend to just step out of that fray and I'm like, just you figure it out and tell me, and then I'll tell you how to like
Right.
you figure out you want to help old people or you want to help babies. And once you got that decided, then I'll help you. But I'm like nervous about choosing. Um, yeah, so the economists like the simplest version of what economists discuss is just we try to maximize the welfare to everyone possible. But I think of examples where, for example, Canada, I do at the end, we talk about different kinds of healthcare systems because all healthcare systems have a fundamental set of problems we're all facing that we just all deal with it in different ways. And there's going to be some disadvantages and some advantages. So Canada, everyone that lives in Canada is automatically enrolled for their healthcare. They're always covered from the first time they show up at any provider, always covered. The out-of-pocket expenses are very low, the taxes are higher, but the disadvantage of the system is there's no market at all. And so what happens is whenever we don't have prices in the system, you tend to have to pay in other ways. So they pay in time a lot. There's long waiting lists. When I interviewed at the University of Toronto, they were like, "Oh, you should probably get on the list for a pediatrician soon." And I was like, "I'm not even married." Like, what? And they're like, "Well, you need to get on it because there's a long wait list. Like, before you're pregnant, get on the waiting list." Um,
No.
and so I put up a post on that one time, and there were some Canadians who wrote about it, and it's very equal. It's a very equal system, but they have these really big disadvantages that you end up paying in time. Um, and and this isn't all Canadians, right? But this Canadian was like, yes, sort of like that is something we understand, and we've just decided that's what we want, right? Like we are willing to take the hit because we decided equality was so important to us.
Sounds very Canadian.
Yeah.
Yeah, it
Very
really.
fair, very moderate, very patient.
I my experience with healthcare is almost non-existent until 2 years ago. Well, no,
Okay.
actually 4 years ago, and I woke up. I was I was going to the beach and woke up first morning down there, and I had lost hearing in my ear,
Oh.
and I had an acoustic neuroma, which we found out later, which had was a little tumor that had attached to the vestibular nerve, and so it had taken away my hearing and also taken away balance on my right side of my
Oh,
head.
wow.
So I had some vertigo, and so I had to um, begin to understand how. I mean, here I was in my late 60s having to, for the first time, really become engaged with the healthcare system. And I went to an urgent care place, and they gave me some stuff for the vertigo. And then I got to meet with an ENT. I was living in over in Wilkes County at the time, so I went to this ENT up in Boone, and he was great. And he said, "Well, I don't do surgeries anymore," so he sent me over to Wake Forest to a physician in the neurosurgeon ENT thing. So I've been going to all of these different things, and and having the experience. This is what my experience is. My experience was if you're don't know what your problem is and you can't articulate what your problem is, then you have a difficult time getting the care that you really need.
Mm.
And but when you're capable of articulating, this is what my experience is, they say, "Oh, okay, now we have to go." And then then in 20. was what did when 2023, I was working out on a treadmill and I got off the treadmill and my hip was hurting and it was as it turned out I had to have hip replacement surgery the following year.
Oh gosh.
And and so I had to go through that whole process. And it was fascinating because because before I could get to the surgery, I went through all this other stuff. And so I had these I had a symptom that no one had an answer for. Meaning I would stand if I was standing, my feet would go numb and then my legs would go numb like just like that.
Wow.
And I'm a retired minister. I was
That
subbing.
seems bad. You can't be very mobile if you have numb legs.
That's exactly right. And so I was in Wyoming I was subbing for two pastors for over the course of 3 months. And I would have to not be in the pulpit. I would go out to a table in front of the sanctuary and have a stool that I would sit on to do the service. Because if I stood up, I'd end up having to sit down.
Uh,
And so I went to the neurosurgeon, I went to a spine specialist, I went to physical therapists, I went to all these different people. And my Medicare is taking care of all of this. I'm paying
uh-huh.
a $25 copay every time I go. And frankly, Tina, I had the most enjoyable experience of being in the healthcare system because of course, I like to talk to people, but I was able
Hmm.
to talk them through what I was experiencing, and they couldn't figure out why I was having this loss of. I mean, I was doing a funeral, standing by the graveside, and the two of the people from the funeral home were standing next to me, and I said, and I felt my legs going, and I said, "Catch me," and they caught me by the elbows as I was falling.
Oh
I mean, it
gosh.
was that kind of
Yeah.
thing.
But all of this you are able to explain in a clear way.
Yeah, and so what I'm saying is that I know there are a lot of people who have real issues with our healthcare system. Maybe it costs too much,
Hmm.
but I think it's extraordinarily effective.
Hmm.
And I'm a beneficiary of that, and I'm grateful for what I have gained from it.
Hmm. Yeah, because that was going to be a question for you, because often people in your age group have a lot to say about what they find frustrating or confusing about healthcare.
Well, I don't allow myself to be frustrated, and I'm going to ask people. I'm going to I'm going to to use a word. I'm going to litigate my health with the physicians and their staff when I'm in the office with them. I'm going to ask them
Mm.
questions, and they're going to ask me questions, and we're going to come to understanding. Um, and it's and I think that if we had better interaction like that, the the value of healthcare would grow in the minds of
Mm.
people. That's really where I'm trying to take that.
Yeah. Yeah.
And
I'm currently
the cost would not seem so costly.
Yeah, that's true. People, so there's something we talk about in health, like if you compare across countries, how much do we spend on healthcare? We spend a lot more, but rich countries spend a lot more, and it might be because health is the kind of thing that as you get richer, you would like more of it. Like if I can improve my health with some of my rich money, a rich being sort of a relative thing, of course, then yes, let's do it, right? So maybe it isn't necessarily that people begrudge this much of their income. It's more they don't feel like they're getting back what they're putting in.
Well, my goal is to live to 105.
Okay.
So I've got another 30 years.
Hmm.
30, I have 33 years to go. So um, it's got to work. It's got to work for me, and I got to work for myself. But you see, I think if we take that kind of approach to our health, and then we'll find. I think what we'll find is there will be a lot better communication going on between the systems and the people, and that is a better thing than what we have now.
Yeah. So I'm working on a piece right now that's looking at trying to look at new ways of organizing healthcare. And so I'm examining concierge care, but through
Yeah.
the lens of concierge care is extra. It's kind of fringe a little bit right now, but you pay a doctor some fixed fee, and then he just sees you. And I think it's right now it's most attractive because it's expensive to people like you that are interested, like they want to be active producers of their health. And because one thing that's a little weird about health, like if we think okay, this isn't working. What if we just took models from other parts of the economy and just threw it on here, right? And one thing that's different about health that gums stuff up a bit is that in other places, the consumer, you just buy it, right? You buy a shirt and you wear it, right? I am not involved in like making the shirt or designing the shirt or any of this, but health isn't like that. I'm consuming the healthcare, but I also am necessary as the producer, right? So if I'm
Right.
given a prescription, I need to follow it properly. Or if I want to create better health, I'm going to have to, if I want to control my diabetes, I'm going to have to exercise and diet and all that. So we have this weird thing that the consumer is simultaneously the producer of the thing you want to buy. Um, so concierge care, of course, is kind of combining this because it's more of a sense where the patient can talk with the provider about whatever their goals are, right? I want to live to 105, and the primary care physician could be like, all right, well, let's talk about how we would do that, or what's your life now? What would we want to change? But all of that is better interactions. And so in the piece, I'm talking a little bit about what does insurance pay for? And insurance doesn't pay for that, which is why many patients like you or active people that care about their health or physicians that wish they could do that kind of work are frustrated with the current system because insurance doesn't pay for time chatting and they have to have such churn through their practices to be profitable.
Hmm. Well, two things. One is I almost bought into a concierge practice,
Yeah.
and if I had moved to Wyoming, I would have done that because it just seemed like the most. Because I knew the doctor, he was a friend, and
Hmm.
I liked him, and I'm going to talk with him anyway, so I might as well pay him to
Yeah,
get
I had a
for his
great doctor
attention.
here and he's left for concierge care. And I'm like, it makes sense because you seemed great and you wanted to talk to people.
That's right. The other thing is that I recognize that um, people are very susceptible to the messaging that comes through the media and from and social media, and that in many respects it places them at a disadvantage as they enter into these very complex systems like healthcare, and that they come in with a lot of fear and a lot of
Mhm.
uncertainty about how am I going to negotiate this. And if you just go into any, you can go over here to the hospital. I'm 5 minutes from the hospital over here at Baptist, and you could walk into any of those waiting rooms, and you're seeing people who are are not adequate to the task of being really clear about their health care. And
Mm.
what my hope is that once they've had that interaction, they become much more adequate, much more effective in saying, this is what I want, and this is what I'm willing to do to secure my health.
Hmm. Mm. Yeah, I think all of this has leadership floating around in it
Yes, it does.
somewhere. Yeah.
Um, so so let's look forward into the future. Because I don't know how about you, but I feel like we're at a one of these inflection points in human history where
Mm.
everything that we've known up to this point is about to change in a dramatic way, and we don't know actually what's coming. And so we have to prepare for a range of things that could happen. Um, and it won't happen overnight, but it'll happen during, well, at least my time, if not during yours. But the turn of the next century, healthcare will look different than it does today. I
Mm.
suspect.
That's what I'm hoping. That's why I'm trying to interact with the public and do my writing and things because what I find interesting about this as an inflection point, I try to treat it gently of like it's not the problem of the healthcare system. Like they were doing a good job, but what we need has changed. So So if we want to do like a look back to look forward thing, we started in the 1900s. Life expectancy was like 45 years, and now we're like we've more than doubled. It's amazing. In 100 years, which in human history is astounding. Um, so the 1900s, it was all infectious disease was getting us. It was the world was literally trying to kill us. And so we discovered like germ theory finally made its way into the world. Discovered sulfa drugs. So by the 1940s, we've got that working for us. But really, it was about infectious disease. We learned that we had to keep water clean, food clean. That helped a lot. So really, what was bringing down the life expectancy in the early 1900s wasn't that you died at 45. It was that so many children died, like one in three children would die. And so you like when you take the average life expectancy, it was very low. If you made it past this infectious disease danger period of like 5 and younger, generally you could live pretty long, especially if you were educated and more wealthy, right? Like, I think Thomas Jefferson was living to his 90s. But you had to survive that beginning infectious period. So that was killing us before. We moved on, and by the 1950s, we started to look inward a bit more. So we're trying to look at cancers and things that are attacking us within our body. And so that's where we've been, right? It's been all these acute killers. But if you look at what's killing us now, cancer's still in the top 10, but it's heart disease, diabetes, hypertension. So all these kind of obesity adjacent things. A lot of these have a big preventive component. A lot of these also have a characteristic that they happen over a long time, right? It's not your broken leg. It happened at some point over the past 10 years or 20 years, and at some point we probably should have started intervening, but we didn't know it was happening. And I think that's a totally different problem for the healthcare system because the healthcare system is really well set up for something maybe like what you were describing, like there is something bad that just happened to me. Let's figure out why all of a sudden it changed. But in terms of I have developed type 2 diabetes, that was a long-term intervention. And we don't really have a preventive focused system. So I think that's where it needs to go in the future. Something like this concierge care where we actually kind of have to backtrack to looking at a broader environmental system like we used to when we would think about bacteria, but now it's instead of the environment attacking us, it's sort of us interacting badly with our environment, like the
These
actions that
are
we take as a human.
they're more lifestyle questions than they are
Yeah.
environmental questions.
Yeah, and like yeah, choices in the terms of food, choices in terms of how our world is organized. So what does mobility look like? What does sleep and stress look like? Um, what are the environmental toxins around us? All of these things accumulate over time, and all these things accumulate over systems, which are we don't have great systems set up to monitor population-wide disease. We saw that when COVID hit, when we were trying to figure out what are the COVID rates everywhere, and one of the big, so the New York Times was doing a COVID rate tracker, and so is Johns Hopkins University. Neither of these are like public health agencies, right? But just every public health agency, this is your decentralized versus centralized. They're very decentralized in the US, which means they don't connect well into a population-wide study. Each individual health agency reports to a state agency with different, like if you wanted to find COVID information, it actually took a lot of work to piece it all together into
Right.
a national map.
Yeah, I followed a lot of people who were in that in that COVID arena, on both sides of that controversy, whatever you want to call it. And it was really fascinating. It was fascinating because it was like a set piece for every other large conflict that would could come to a society. And it just happened to be healthcare. But you could take like what we're seeing in cities now. Where cities are, um, you know, have all this violence going on in their
Mm,
cities. And the question is, what's going on there? Why is that happening? And there's an economic aspect to that. Um, and it depends on who you read and who you're listening to. And
yeah.
so I think where I'm going with this is that it's really difficult to know anything for certain. you know, I watch a lot of YouTube, and I see that a lot of these scientists and physicians telling us stuff that they are being very categorical in stating this is what is true. But if you actually are listening to them, they're being very reductive in what they're saying. They're taking this little thing, I'm saying this is absolutely true, but what is the larger context in which that little thing is operating? And so I'm coming back to what you do as a professor is that one of the things we need to be doing is teaching people at a younger age about these sorts of questions, teach them about economics, teach them about health, things like that. And that the system of education has to change in order for the sort of things that you want to see happen to have an easier pathway to fulfillment.
Yeah, I think this brings us back to what we started with in a sense of like a lot of what you just described of some experts being 100% certain of a thing and talking about it. That seemed really on display in COVID in the sense of the epidemiologists talking about social distancing and staying home and all of that was absolutely true if your goal was like bringing the rate of infection down, right? That's a reasonable goal. But then there were there's these competing goals of, well, children need to learn. Also, people are starting to go crazy because they're in their houses uh, or like I loved essential jobs. I was like, everyone kind of feels their job's essential because if they don't get paid, they can't buy food.
Well,
Um,
they're essential people is really what
yeah,
they're
yeah.
describing.
So
Yeah.
so while they are correct in their lane, right? But there was a lot of like own lanes happening and not a discussion about what is the overall goal. And there's going to be some trade-offs and what are the trade-offs that are acceptable to achieve this goal.
It's a
It's easy to
fascinating.
say this in hindsight, right? But um,
Well, yeah, it is fascinating because um, I'm 72 years old, turned 73 in a few months, and where we are and where we've been, say, for the last 20 years, say from the time of the Great Recession, which I guess we could talk about that too, could
yeah.
um, is a totally different world than I experienced prior to that.
Mm.
And it's um, and I have lots of opinions about that, but what this is where I'm really interested is how do people and their families look at the complexity of all this that goes on, whether it's economics, what goes on in their city, what goes on globally, globalization, all of these healthcare, how do people in their families raising their children um, deal with that in a way that it's not just overwhelming, it's not frustrating, and it allows for their children to watch their parents process
Mm.
large complex issues so that they learn how to process these large complex issues.
Huh.
And I'm
That's
asking you as a
interesting.
mom, I'm asking you as a mom there, of
Yeah,
course.
I was thinking about our role as parents in that we are thinking I have a cousin that has this he's a bit older cousin, so he has a daughter that is already out of college. And he so and she's great. She's amazing. So we're always like, okay, what are you doing? Like we're just gonna copy. And he said something about like just making yourself a better person, and that's how you raise your kid by making yourself as good a person. So the idea of trying to give answers on all of these problems, right? AI is going to come through. I don't have answers for the kids on this, right? But showing them how you work through the complex problems that are coming at you, um, would give them tools on dealing with whatever the next problems are. Um, I think about it a lot because I think about, especially since I get to see 20-year-olds and I see what social media does to their brains. Now I've also got a COVID dip. Like there are clearly some educational setbacks in their high school years. Um, but then I'm always worried. I'm like, well, how did parents miss this? Like, how did they miss how destructive this was to their child? And I'm like, I don't want to miss it. And now the AI is here. I'm like, oh, okay, that's going to be it. Like I've identified the thing. I'm not going to miss it. It's definitely AI for my children who are in elementary school. Uh, yeah, but you just seeing you struggle about how to make choices is probably the best you can do.
When my oldest child, my son, who's now 40, so when he was 12, so we're in the middle 90s, I was watching, I mean, this is right at the beginning of the internet digital era, so um, we had one computer in the house and there were no smartphones. We just had classic cell phones. So, um, but I recognized what was coming, and I recognized that um, my children needed me to be different with them than my parents had been with me, and so I decided I was going to treat my children as adults as early as I could, and and. And what I meant by that, I'm going to talk to them like an adult. So if they have a question, I'm going to say, "Well, what do you think? Well, tell me what you
Mm,
think." And we're gonna have an interaction because I wanted them to learn how to think for themselves. I said, well, if you don't know, then where are you going to go find out that information? And so this is
mm.
really before the internet had taken over, and and so it really was beneficial in helping them become much more independent, much more self-critical, and be able to look at the world not as a set of choices, but actually a place to interact and as like they're in a relationship with all these different factors that are affecting them.
Yeah, that's interesting. I'm thinking about you saying like, where are you going to find that out? I wonder if something for like for the children that I'm raising, it's a little the inverse, but the idea of like, well, how are you going to approach that or something like that? Because if
Yeah,
you want an
it
answer,
changes.
you can get answers now. Uh, and I think a really important skill to teach them will be to like stay in their own brain, use their own critical thinking before they
Right.
even try to move into the world.
See, I would say that the the answer to that question is not where you're going to find the answer. The answer to the question is what is the question you're asking?
Mm-hmm.
And why is that the question? Like
Yeah, yeah, yeah.
this is what I'm dealing with this book I'm writing. Because I taught, I did, as a minister, I was doing university ministry from 1988 through into the middle of uh, the first decade of the 2000s. And some of that time I was teaching. And what I found was the students would come to the class and they had never been taught to think. They had never been taught to ask questions. They want to know what was on the final, we on the
Mm-hmm,
final. And I was really struck by that because I felt like I couldn't be a very good teacher if they couldn't ask me the right questions because I didn't know what they were thinking. They didn't know what they were
Yeah.
thinking. But so I think that learning to ask the right questions is really the key. And that's a thread that's going to go through this novel I'm writing. That's why
Mhm.
it's called Answers to Questions Never Asked. So what are the questions we should be asking and are they going, I mean, this is a generational question. So are the questions a 20 or an 18 or a 20-year-old going to ask, are they going to actually make sense to the 72-year-old retired person who already has all the answers and thinks that all they have to do is listen to this old
Hmm.
guy and oh we'll just bow down and we'll follow what you do. No, that's not it doesn't work that way at all. So now we have
Unfortunately.
huh?
I said
No,
unfortunately.
no, it's fortunate. No, I think it's actually fortunate because we stopped asking those questions
Hmm.
and we don't know why we believe what we believe. And
That's
so
true, but the world doesn't just like freeze at our 40s, right? Like, oh, I figured it out by 45, and then. the world stopped.
But there are a lot of people who do think that.
Hmm.
And as a consultant, I've seen them, and they're running businesses and they're running organizations, and they don't present that as their way of being. But when you work through, say, a problem, you get hired to come in and solve a problem, and you find that they never implemented the solution, even though we designed the solution. You realize, they're just going to be content to live with the way they've always lived for the last 25 years, and then they'll retire and they'll have their pension and they'll have their Medicare and they'll be fine. That's what they
Hmm.
think. That's kind of my generation's thinking. We're
Hmm.
doing what our parents did and we'll be fine. Well, I don't think that's gonna be true for your generation and the generations that follow you. And that's the opportunity. That's why I think there's a great opportunity now to take these younger generations and say, what kind of world do you want to have? But where do you start with the questions? What kind of questions do you need to ask if you're going to create a world that you want to live in? Because they don't want to live in my world. And
Mm.
I'm not being negative about that. I'm just being observational. And that's fine. They don't need to. I don't think my generation has the answers for our time. That's really where I'm getting to.
Yeah, you might need some new answers for new times.
Absolutely. Yes. And that
Well, and I'm also trying to keep them grounded since we met at church, right? Trying to keep them grounded in these um, longer lasting, because I that's what I also feel right now that with social media, with the loss of religion, people are just like floundering because you have to be connected to something that at the same time has been true over time. And it could be something, it doesn't have to be religion, I guess. Where my husband and I are very interested in Stoicism, right? So we've got like these Roman teachings. Turns out we're facing the same problems that they did back then, grounding you in something that is core to humanity. And
well,
then you can bring that to the questions, bring that to the world around you.
there is a kind of thread of Stoic Christianity out there.
Hmm.
But this, I think, is important for everyone that's watching to understand is that there are answers that are for the questions we're asking today. There are answers that go back generations, 10, 15, 20 generations, go back millennia. There are millennial answers out there if we just ask the right questions to understand why those answers actually matter for us today. I think that's part of the learning process. And if you spend much time on Substack, you find that there are these people that are addressing kind of classical philosophical questions, but they're not addressing them from the standpoint of, well, I'm going to be a Platonist or I'm going to be an Aristotelian or I'm just going to ask the questions and I want to live the best life I can. What does it mean for human flourishing?
Mm.
And I think that comes back to what you're involved in with healthcare is if we were to develop this kind of preventative aspect of healthcare, um, we would, I think, see costs go down, but we'd also see human flourishing go up. And I think
Yeah.
that's a that's a promise that we should be talking more about.
Yeah, because you use health. And I'd like to talk about what is health if it was a product that you could like buy at the store, right? You use it to do your job, but you use it for your leisure and you also just like enjoy having it. If you're healthy, the things you get to do are it's a broader swath and you just feel better. You live longer, you can be with your children longer. Yeah, all of these things for human flourishing. I'm actually involved if you or any of your listeners know about the progress movement. So it's just a movement trying to think about how does humanity make progress? How have we made progress? How do we make sure that we still make progress? And so there's a lot in the progress movement of like longevity research and things like that. And I think what I'm doing, I often felt like they didn't think it was as cool or something as, these drugs that will extend your life or whatever. But I'm like 18% of GDP. Imagine if we turned it to like 15% of GDP and we had 3% of GDP, we could just do whatever we wanted with, like go to space. Come on, this is important. Like let's fix this so we have 3% more of GDP.
I like that. That's great.
Yeah.
Well, connect with some of those people because I'd love to interview them because people all over the world are going to watch this, and so
Mhm.
we have this opportunity for people to be influenced by this, and so I'm totally on board with that, and would love to learn more. Well, I think we've come to a end of our time. I want to ask you one last question. Um, what is it? Where do you find hope for the future? That's kind of a common question I ask my guests because I want people who are watching to get connected to their future by asking that same question. Where do you find hope for your future? And what do you have a way of thinking about that or talking about that?
Well, when we've been thinking about what to do with kids, one thing I think is so important. I think it's unfortunate that fewer people are having children because once you have children, you realize, oh, I should care about the future. Like if you're just yourself, then why should you care about the future? So I have kids, and I think so yeah, I want to improve the future for my kids, but I think that I even in specific to my family, what I love is that my in-laws, who are amazing, they are so grounded in trying to work on their family and the generations. My grandmother was like this too, but and so I feel part of like a greater scheme because I have the seniors to me being so invested in my life and I'm invested in my children's life and trying to connect all of this. So now we've got, 70 to age 6 trying to create this line every day, right? Or my in-laws right now are actively working like how can we grow our family? How can we make a good life for our family? How can we think about planning for the future of our family? I think I get a lot of hope out of that because I feel like we've already got 3 generations here that are actively working every day to just push all our lives to be flourishing. So I get a lot of hope out of that. And I want to be that, right? I'm just so feel so loved by people trying to take care of me and my little ones that I'm like, I'm gonna do that too. And so I'm taking notes, right? I'm like, so when it's gonna be me as the elder generation, like, what am I gonna do? So then I have goals for the future that way.
Um, I have to add this in here because this is what you have just described is what I have been working on for a year. This time last year, I decided to take a sabbatical from writing, and I put aside what I've been working on for about 3 years, and I decided I'd look at time and reality as a subject, and I read only dead authors, for example, and out of that emerged a couple of things, but probably the most important thought that came out of that is what I call generational memory, and that our sense of time and our sense of history is really a function of the memory we have that has been passed on to us by previous generations. And in my family, we go back. We know where 10 generations back were, and we know what they were doing, and so that has an
Mm,
effect upon us. I had a woman who I grew up with invite me to come to dinner at her house for what she calls her genealogical dinner for her family. And she said, I want you to talk about generational memory. And so the idea is that we are the products of what has come before us, and that generational memory is really about the continuity of time from the past through the present into the future. And that our real challenge, and I think you've already described this is why I'm saying this, is that, and I feel this, I want to live in such a way that I'm having an impact 2 and 3 and 4 generations ahead into the future. I want them to remember me because of something I did that has been beneficial to them,
mhm.
at the turn of the next century, which is 2 or 3 generations ahead. So that I think is really important, and I celebrate that, and I encourage you, and I celebrate your in-laws for also having that sense of generational memory being really a core part of living a human life today.
Yeah, it's a
So
good mission.
it is. Thank you, Tina, for being here, and appreciate you very much.
Well, thank you for your conversations,
And
all
uh,
of them.
and uh, I hope your students appreciate you as much as everybody who's going to watch this will.
Thank you.
And I thank you all for watching. I hope you've gained something from this, and you have a sense that um, you have some agency in economics and healthcare and things like that that maybe you didn't realize you have, but you have it, and make the most of it, and create your generational memory for your own kids or for your own grandkids or for children that don't even exist yet. But do that. And we'll see you next time here on the Eddie Network podcast. Thank you. Bye bye.